Good morning.
Good morning. My name is Al Grantz.
Well, good morning, Al. What health complaints did you have prior to coming to our office?
Well, I've had idiopathic peripheral neuropathy for 10 years, along with rheumatoid and osteoarthritis. They're my biggest complaints.
Okay, well, how long did you suffer with those?
Since about the year 2000, 10
Wow.
or 11 years,
Mm.
yes.
How did that affect you in your life?
Well, it affected everything. The worst part was that the medicine I was on, methotrexate for my rheumatoid arthritis, was a very powerful medicine. It was developed as a cancer medicine for women, but for about 25 years they've used it for rheumatoid arthritis, and it worked very well on me. The problem was that every time I had a blood test, which was monthly, my red blood cells were very suppressed. And I asked my doctor, my primary care physician, how long I'd have to stay on this, and he said forever if you don't want any pain. So I asked my rheumatologist the same question, and he said the same thing, forever. Well, it's always concerned me, and I heard Dr. Durr and Dr. Childs talk about, having some kind of a remedy. And I come in and I talk to them, and what they said was that my autoimmune system was attacking itself, which is causing these autoimmune diseases, rheumatoid arthritis, basically, and neuropathy. And I'd never heard that theory before, so I signed up.
Well, since having care with Dr. Childs and Dr. Durr, what's changed?
Well, I've been here about 4.5 months. First thing I went off was furosemide, which is a water pill, and potassium, which you have to take when you're on that water pill. Then 4 weeks ago, I went off my methotrexate. Now my rheumatologist had told me I could never get off this for more than a couple of days without the pain coming right back. I've been off for 4 weeks, and that's not a long time, but I don't have any pain. I also took my neuropathy problem. I was taking Neurontin for that, and that's a 600 milligram pills every 8 hours, 24/7. So I was taking 1,800 milligrams a day. I cut that down at the same time to 600 milligrams. I just take 2 pills before I go to sleep at night. And I plan to soon cut that in half and see how I can do without, that. Now I'm still on a pain pill, Dolac, which eventually in the next few weeks I'm going to try and get off that. So it's great to be off these pills, and I'm anxious to see my next blood test, which I will get November 1st, to see whether, my red blood cells are still suppressed.
So, how's all this impacting your life, Al?
Tremendously. First of all, my wife, you know, couldn't believe it that I take an array of pills, and I have to, when we travel and so forth, I've got to take these pills with us, make sure I'm taking them at the right time and so forth. And all of a sudden, I've cut out two, five, uh, 7, 9, 11 pills. I mean, my daily deal here. So it's affected me tremendously that way.
Wow. Do you have any other thoughts on your experience in the office, the doctors, and the staff?
Well, I just think the doctors are fantastic. I have to say this. I was extremely skeptical. It sounds great, but they said if they can just get my autoimmune system not attacking itself, things should improve. Well, damned if it hasn't. I mean, I'm nonplussed. I mean, well, I just couldn't believe it. I mean, talking to my primary care physician, talking to my rheumatologist, I'll never get off these pills. And I was really concerned about that. My primary care physician said you'll have to take these, forever. I don't like that. I mean, I don't think anybody likes to take pills, but
Mhm.
boy, I tell you, I am just so happy. I think Dr. Durr and Dr. Childs are eminently qualified. They're tremendous doctors, and the whole staff is extremely well qualified. Everybody knows what they're doing, how they're doing it, when they're doing it. things just roll in here, and boy, it's a busy office. I've never seen a chiropractor's office this busy. But I can understand why, and I'll tell you, I'm living proof. I just like to shout it from the rooftops. If you've got rheumatoid arthritis or osteoarthritis or neuropathy, as I have had for 10 years, and you want to get rid of it, come talk to these people. You got to do it.
Well, thank you very much, Al.
You're welcome.
Thanks.